Welcome to the first episode of our new podcast, the Preventative Health Traveller. We are starting a new company, a new project. It is called Altavita, and we're very excited about it. This episode, we're going to dive into what it is, a little bit of the background, and a little bit more about medical wellness tourism, what it is, what the future of it looks like, and we're going to focus on, what to expect for the rest of 2025 and into 2026 in terms of our project and also just the industry as a whole. So first, just to give you a little bit of background, Altavita is, a passion project. It's an idea that we've had incubating for a decade, I'd say. We'll go in and to the details of the infrastructure that we've been building and considering for a long time. But the key, it's three intersections of advanced medical diagnostic testing with holistic wellness, lifestyle coaching, and immersive experiential travel, specifically to the heart of Chiapas, Mexico. So, Jose, kick us off with a little bit about medical tourism and also a little bit more of your background specifically.
Yes, thank you, Megabal. I'm Jose Antonio Muñoz. I'm doctor for about 20 years in the area of the vascular surgery. And I am absolutely conscious that the idea to change the lives is not through a surgery. We need to change our style of life. And before we dive into Mexico and Chiapas, let's take a moment to understand what is the medical tourism. Well, the medical tourism is when people travel to another country, specifically to receive medical care. This can include anything of surgeries, but inclusive checkups, regenerative therapies, holistic procedures, holistic treatments, and cosmetic procedures. Why Mexico? Why Chiapas? Well, the environment to Chiapas is a rich natural forest, jungle, waterfall, Mayan culture. Then I'm very happy to start this new project, Altavita, in Chiapas. More, that is a new era in the private hospitals in Chiapas, that's a very high quality of the attention and medical attention for any kind of disease. That's the idea, to try to put together the holistic with the science.
Exactly. So we're really focusing on empowering people, giving them the data, the information, and then also the strategy on key lifestyle changes that they can implement immediately to really shift and change their trajectory in terms of all chronic disease and really just live better now, but then also have the better plan and trajectory for the future. And we wanted to talk a little bit about the medical tourism in Mexico as a country. It's really not anything new. Definitely goes back several decades. There are probably hubs that you're more familiar with. They tend to be centered around the tourist, beach destinations, and then also along the U.S. border that primarily, I believe, attracts mostly Latino Americans that you know come for all sorts of things, everything from dental to checkups or more invasive surgeries. And one thing that we really noticed in terms of a gap in the market in Mexico is you have a lot of options to go do like a wellness retreat, and you have options that are purely medicalized. They're not necessarily treating you holistically. They're not necessarily giving you the perspective on how you can, improve your health immediately. And yeah, we're also, inviting people to this lesser known gem in the south of Mexico, Tuxtla Gutierrez and San Cristobal de las Casas, to key cities in the center of Chiapas.
Yeah,
So
Mexico. Sorry.
yeah, what are some of the like more common procedures that people think about when they're thinking about traveling to get them done?
Yes, Mexico has long been one of the world's top destinations for medical tourists, especially for travelers from the United States and Canada and Latin America. But why? Well, first, it's close and convenient. Two, medical care is high quality and affordable. Many healthcare professionals are bilingual and training internationally. Most of the or our doctors have one kind of specialty outside of the country, United States, Canada, Italy, Europe. And the country offers comprehensive experience that combine medical service with rest, recovery in an environment wonderful with a wellness specialty. Try to make a very, very nice experience and have a very deep checkup, medical checkup. This checkup is specific for your needs according to your age, your sex, and your background, your family story. There is a specific program for each patient. And then that's important because we use the science for trying to make the most professional tests in each patient.
Yes. And I think we can speak to the fact that basically for the last decade, we have been doing this for friends and family in terms of connecting them with the medical treatment they needed and or just giving an additional opinion to what they were already receiving in their home country. And we're inspired to really well, when it comes to the US, like you mentioned, it's really giving people more options in terms of the radical difference in price to prioritize their health and get these things done, and even just getting the medical tests done so that they really know what's going on and can then make decisions according to having more information about their health faster. And in the example, or in the case for Canada, it's more about efficiency of time. And I think for both countries, because I have friends, contacts, networks in both countries, and I've heard so many stories over the years. There's just generally speaking a little bit of a disconnect in medicine 2.0 in terms of treating the whole patient. So we're offering this perspective where you're getting multiple specialists looking at your health at the same time to understand what's going on as a whole, not just treating an individual symptom or looking at one aspect of your body or one system in your body at once, which ultimately can kind of just be is less efficient and less effective. And we really believe in the true essence of preventative medicine is understanding the individual as a whole and giving you as much information as possible, allowing you to make better decisions in your life and lifestyle.
Yeah, the prevention is the solution. We are very understand about this, but we need to know where we are standing in our health. Then this is the idea to start in which moment of my life, how is my health, and then start to move. The idea is try to convince, change your life for something better in your body, in your health. That now is I want to talk about the hidden gem about Chiapas, because you can say, well, where is Chiapas? Oh, well, Chiapas is in the south of Mexico. We told like last border. We have a border with Guatemala, and Chiapas is the northern jungle in the North America. This locality in southern Mexico. and have a rich culture, biodiversity, and natural beauty. But many people don't know about some really, really magic town cities like San Cristobal de las Casas, and the Chiapas coast is beautiful too. And then that's the idea that put all a great experience to try to move the change your life in this new project. We are convinced that the point is the prevention and try to bring to you the best of this part of the world.
Exactly. It's really so much more transformational when you're taking time out to focus on your health and having a better holistic view, doing it in an environment that's really outside of your normal routine. And it gives you that space and that pause and that experience to, swim in a waterfall or do a coffee tasting or just experience the vibrant culture that is the south of Mexico. These things really give you a moment to reflect on what's important to you, and it's much easier to sort of have this moment, this dedicated retreat is what we're calling them, to reset and decide from that point on, now more informed and more empowered with the exact current state of your health and what you can do about it. It's a jumping off point to then go back to your regular life. And the way that we're creating this program, we would be supporting you via virtually or telehealth throughout the year, helping you with the accountability and implementation of best practices and lifestyle changes that are really going to boost your health and prevent as much as possible chronic diseases that are, an epidemic across certainly North America. The other thing, just the hospitality. This is another aspect of medical care in Mexico, and that much more in Chiapas, where, the type of relationship you have with the doctors and nurses, there's just like a different warmth. There's a sense of, you just certainly don't feel like a number. It's just so much more personalized. And the service that we're going to be providing with Altavita is like an additional layer on top of that hospitality, and that will be, holding you from start to finish of this service. And, we're hoping that you stick around in our community as long as possible.
We talk of this concept, the warming. No? The warming is what happens when you are welcomed, when people take the time to listen to you, when you have many questions, and sometimes the the workers of the health don't have the time to supply part to part the details. Very important. Now, the warming is listen to you, understand you, worried for you, and try to looking for answers to you.
Exactly. So we're putting together a extensive and extremely uh, professional and vetted team of different experts in every category. And we'll be bringing groups down kind of based on certain desires or goals. So the first, we'll do another episode that really dives into the specifics of what each demographic phase of life, different, symptoms or issues that people are experiencing or worried about because of family genetics. So yeah, I wanted to say here that the idea is to really bring people together strategically as well. So the experience in itself, you're going to feel like you're a part of this little community going through the same experience. We're thinking groups of, 8, 12 maximum. And, it's going to be a life-changing experience. And we're quite confident that you're going to want to come back after the first one as well.
Yeah, and for the next content of this podcast, we want to know about you. If you have some kind of question or talk about a specific issue, it's very important for us. We will talk about this mix or this interaction between holistic and scientific of all the different disease or different states of the health. But it's important you can send comments. This is important for us, listen to you and try to, if it's possible, resolve some of your questions.
Exactly. So really stressing here, our vision is blending precise diagnostics with wellness lifestyle changes and habits and immersive cultural healing, like really just having an incredible experience while you're going through this, while you're learning this new information about yourself and how you can live a better life. And the next episode we're going to be doing focusing on women's health, which is the first cohort that we're bringing down in the fall this year in 2025, focusing on hormones and that delicate transition, perimenopause and menopause, and really what you can do and how important it is to really have an understanding of your baseline before you go through it. And have that again trusted support as you're going through these key changes in your life. So please leave any comments and questions in the comments about what other things you have questions about, whether it's symptoms or medical concerns or a certain sub-theme that we can focus on to help you understand what this is all going to look like. Anything else you wanted to add?
No, just try to let the message of be healthy, travel with love, and be part of the experience.
Beautiful. We look forward to hosting you. And if this resonates, please like and subscribe. Thanks so much for listening and watching.
Bye.